We do not have the workforce we need. Much of the workforce we have is going to be reaching retirement age over the next 5 years. And there are certain pockets of the workforce where we're really hurting the most. That's particularly child psychiatrists and psychiatrists generally. I think we should be clear about this, that we've actually trained quite a few psychiatrists, but as you probably know, 57% of them nationally do not accept Medi-Cal or Medicaid. 42% don't accept any insurance. So we have a lot of people who are out there, but they're not serving the public need in the sense that we're experiencing it as we look at the population health issues for California. We've talked a lot about what are the other pieces that could be built out there. Can you get a nursing staff that can do this? Are there ways of using social workers and marriage and family therapists and peers? And are there others that we can begin to bring into the workforce? We're going to need more, probably everything. And it needs to be organized in a way that is actually much more effective than what we have now. So I do think it's important to recognize that when we're talking about shortages, there are the physical ones, and those are issues that we just have to think about actually building out capacity. But we also have a workforce crisis that we're going to have to address in the very near term.
I wonder if you could talk a little bit about an approach. Some people may think it is the answer. I think it's probably an answer, but that is the use of telehealth. And is that a way to expand the number of behavioral health specialists that we have, and really trying to get their expertise in the right place at the right time? Your thoughts about telehealth in this area?
Sure. I mean, telehealth is catching on across all of medicine, obviously, but I think behavioral health is a little more adaptive. It may be easier for the telehealth issues because often much of what you want to do is a talking intervention, and much of the diagnosis is a listening process. So this doesn't require often a blood draw. It may not require a surgical intervention. Lots of opportunities here to be able to use remote resources. You still there's some issues around how it gets paid for that we need to figure out. There's still some constraints, and at least in some cases you have to have a provider on both sides of the call. So it's not really set up yet in the way one would hope, which is to provide remote care for people who don't have access. So I think we still have a lot of work to do with this, but absolutely the future is going to be not entirely, but much more digital, and it allows us to extend the workforce we have. You still need to have the high quality people on one end of that conversation so that you're providing the high quality intervention. So there's got to be this opportunity to, whether it's through telehealth or not, to make sure you've got people somewhere who are available at the time when you need them.